everyone. In this lesson, we are going to be talking about celiac disease. Okay, so celiac disease is a chronic GI disorder that's usually diagnosed between 1 and 5 years of age. And this is often when solid foods containing gluten are being primarily introduced into the diet. Now, gluten is a protein that is found in carbohydrates like wheat, and patients who have celiac disease are not able to digest and process it. So when a patient who has celiac disease eats gluten, what's happening is that an allergic reaction occurs that actually causes severe damage to the villi in the intestines. Now, just as a quick anatomy reminder, the villi in the small intestines are these little finger-like protrusions that you see in the intestinal wall. And they are so important for the process of absorbing nutrients. So if these villi are being damaged by the gluten, the patient is going to have trouble absorbing the nutrients that they need. So most of the symptoms that we're going to be looking for in our nursing assessment actually stem from the fact that they are having problems with absorption. So it's related to this issue of malabsorption. Now, the first thing that we see as related to this is actually a change in the patient's bowel movements. And usually the parents describe their child's stools as being pale, frothy, and foul smelling. And the medical term for this is steatorrhea, and this is actually caused by an increased amount of fat in the stool. The next thing we're going to be looking for or noticing because of malabsorption is abdominal discomfort. And so that's usually just going to be a generalized abdominal pain, and you may also notice some abdominal distension on the child as well. So kids with celiac disease are also going to have problems with their nutrition, and this is again because they're not absorbing things. And this usually primarily presents as issues like anemia and vitamin deficiencies. And then you're also going to see weight loss and even muscle wasting. So when you look at these children, they may have that distended abdomen, but then their bottom or their buttocks actually looks kind of concave or wasted because they don't have that muscle mass there. Another thing that we hear all the time from parents is that they have behavioral changes. When these kids eat gluten, they actually become really irritable. And parents say they may even be apathetic about things that should really be getting kids excited, like going to the park and playing. And the very last thing to be aware of when you're doing your assessment of a child with celiac disease is something very important called the celiac crisis. And when this happens, it's often triggered by something like an infection or stress. And what's going to happen is the child gets really severe episodes of profuse watery diarrhea and vomiting. And because of this, the child's going to end up with really severe electrolyte abnormalities, and that can actually be life-threatening if it's left untreated. So definitive diagnosis of celiac disease actually requires a biopsy of the small intestines. But once we get this biopsy, we can start them on the diet that's going to actually take care of all these problems. So these kids need to be on a gluten-free diet. And so this means patients are going to be eliminating foods from their diet that contain wheat, oats, and rye. And a lot of times other foods like corn and rice are going to be used as substitutes for the grain products that they aren't able to eat. In more severe cases of celiac disease, glucocorticoids may be needed. And this is actually pretty rare in children, but it's for patients who their symptoms aren't really controlled with just diet. And remember, if a patient is in celiac crisis, they're going to need fluid and electrolyte replacements. For long-term management, it's really important to remember that dietary changes like this are never, ever easy, and they're especially difficult for kids. Kids are going to complain, and they're going to want to eat all of those things that kids love, like pizza and cake. So it's very, very important that we make sure parents know how much the diet impacts and shapes their health. So if they go back to eating foods that have gluten in them, they're going to go back to having all those issues and weight loss and feeling awful and having stomach pain. So we have to make sure they're educated on all of that. One thing that we can do to really help with this is make sure that they're getting support from a lot of different healthcare providers. And an example of this would be to just make sure that they are being referred to a dietitian, and dietitians are going to be great for giving them knowledge and support to help them make all of these dietary adjustments. Your priority nursing concepts for a pediatric patient with celiac disease are gastrointestinal and liver metabolism, elimination, and nutrition. Okay, so let's go over your key points for this lesson. So the very first thing to know is that a patient who has celiac disease is gluten intolerant. They are completely unable to process it, and when they eat it, they have an allergic reaction that damages the small intestines and ultimately causes a lot of absorption problems for them. Now, when we see these malabsorption issues, the primary symptoms that we're going to notice in patients is diarrhea, so frequent stools, and also it's going to be that fatty stool that we talked about, this diarrhea. Remember, these kids are often malnourished. They may be anemic. They may be missing out on vitamins that they need. So we have to make sure that we're monitoring their weight and making sure they're getting all those nutrients that they need and sticking to that gluten-free diet. And that gluten-free diet is the key to them avoiding those issues. And remember, this diet can be really, really difficult to adhere to because gluten is found in so many foods. So making sure we educate families and that we get them that multidisciplinary support that they need. All right, that's it for our lesson on celiac disease. Make sure you check out all the awesome resources that we have attached to this lesson. Now go out and be your very best self today, and happy nursing.